My name is Samantha Espinosa. This is my Module 8 assignment for medical terminology at Aspen University. This is the case of Don Smith. The assignment is applying medical terminology. The paramedics report that the patient Don Smith, date of birth July 1st, 1985, was an unrestrained driver in a motor vehicle accident about 20 minutes ago, with the chief complaint of lower left quadrant pain in the abdomen, left arm, left leg, and head. The patient denies any loss of consciousness or dizziness. Vitals were a blood pressure of 165/84, the pulse of 108, breaths of 24, the temperature of 96.8, pulse ox of 98%. Splints were placed on the left leg and the arm was in a sling. The head was wrapped with signs of blood. The patient's history of present illness is that the patient is Don Smith, a 36-year-old male. He sustained multiple injuries in his status post-motor vehicle crash, which occurred approximately 20 minutes prior to admit. His vital signs are stable, and there are no known drug allergies. Treatments thus far include a cranial region bandaged upon arrival. Splints were placed on the left leg and the arm was in a sling, and the patient has received analgesics, specifically morphine, as a pain reducer for his injuries. We will review the systems on the next slides. In the INTEGUMENTARY system, the impressions are that there is a nasal laceration with a bump 2 centimeters to the right side of the laceration. There is ecchymosis in the antubical region of the arm with signs of fracture. There is also ecchymosis in the left lower quadrant of the patient's abdomen and ecchymosis of the patella with edema present. In the musculoskeletal system, the impressions are that the patient's decap BTLS is again the nasal laceration with the bump 2 centimeters to the right side of the laceration, the antecubical ecchymosis with signs of fracture, the ecchymosis in the left lower quadrant of the abdomen, the ecchymosis of the patella with the edema. The patient's chief complaint is the pain in the lower left quadrant of the abdomen. They also have a complaint of pain in the left arm, pain in the left leg, and pain in the head. Patient has a history of curvature of the spine. In the cardiovascular system, the patient's blood pressure was 165/84. The patient's heart rate was 108 beats per minute. The patient has a history of high blood pressure and high cholesterol. In the respiratory system, the patient's breath sounds were 24. The patient's SpO2 is 98%, which is their blood oxygen saturation, and the patient does have a history of asthma. In the digestive system, the patient presents with the complaint of lower left quadrant abdominal pain. The patient has a history of GERD, which is gastroesophageal reflux disease. The patient also has a history of renal calculus, which is kidney stones. The reproductive system, there were no observations to note. This is not applicable to this case. In the endocrine system, the patient's body temperature was recorded at 96.8, and the patient does have a history of diabetes, type 1. And lastly, the nervous system. The patient denies any loss of consciousness or dizziness. Patient is ANO times 4, which is alert and oriented to person, time, place, and event. The patient does have a history of dyspnea and GAD, which is generalized anxiety disorder. I will include the terms and abbreviations used in this presentation with the file. Thank you very much for listening.